Please welcome Dr. William Jackson of the General Authority 70 of the Church of Jesus Christ of Latter-day Saints to discuss how to improve health globally through medical, missionary, and humanitarian work.
It is my pleasure and great honor to discuss with you today the topic of medical missionary work. Charity, reaching out to and serving those in need, is a foundational pillar for many of the world's great religions. For centuries, we have witnessed the many humanitarian expressions of personal religious conviction. Indeed, until recently, religious groups were the predominant source of charitable health care. Even today, many provide more aid and are serving in more countries than many governments. Despite the recent explosion of secular NGOs, faith-based groups continue to be ubiquitous geopolitical players of good. Why do they do it? First and foremost, because it is the right thing to do. The need exists. Many believe they will be judged and held accountable for how they treat others, for how they use their talents to lift the arms that hang down and strengthen the feeble knees. They have made personal promises to God to go about doing good. The two great commandments spoken of by Jesus in the Bible are, first, to love God with all your heart and soul, and second, to love one another as He loves us. We demonstrate our devotion for deity by loving and caring for each other. When we are serving our fellow man, we are actually serving God. There are many medical and surgical issues that plague our human family that are fixable. Conditions for which a single simple operation, a single inoculation, or a single medical device or prescription can change the quality of a life dramatically. With need comes responsibility. Time has taught us that there are good, better, and best ways to bless others, and some lessons learned that we would probably rather forget. We have all witnessed unfortunate outcomes that were likely unintended, but very real. My own experience spans many decades and comes from participation and observation of many missions on every inhabited continent. Working with multiple organizations over time has given me, as it has many of you, the opportunity to discover what works and what does not. Many a project is marked by serious waste of resources due to rising overheads, bureaucracy, entrenched attitudes, a woeful grasp of even basic economics and human nature, and innocent ignorance about what would be most beneficial for a certain population. A multi-million-dollar MRI machine feels good to donate, but often sits useless when it can't be maintained or doesn't run on the same voltage available in a given country. Additional common obstacles to successful missions include language barriers, poor awareness of local customs and culture, contrasts between Western science and local beliefs, limited liability and accountability, lack of sustainability and continuity, marginalizing or ostracizing the local medical establishment, poor knowledge of the patients, and claims of evangelism and colonialism, to name but a few. And except in the case of natural disasters or disease outbreaks, the fly-in approach to medical and surgical need has lost much of the luster that it had decades ago, and is actually disliked or unwanted by many recipient communities. Medical missionary work is nearly always well-meaning, but has not always been well-received or of much practical benefit. What are some things to consider when providing humanitarian service? What has been shown to really work over time? Let me share just a few lessons learned in no particular order. The mission should meet actual need. A community may not need a new hospital or clinic with all the latest cutting-edge gadgetry if it doesn't have electricity, trained healthcare providers, or a reliable water source. Get invested local help where possible. The days of Albert Schweitzer are just a memory. Today, local nurses and doctors are almost always available, qualified, and interested. Other good reasons to seek local medical involvement include they speak the local languages and dialects. They can better evaluate the patient's needs and challenges. They know what patient questions and obstacles to anticipate. They will be cheerleaders for the programs they are part of and become our friends. They have the best idea of who has the greatest need and how to reach those individuals. They can help by developing a slate of potential patients if our program is going to be a regular event. They help find local solutions to local problems. Find a way for those being helped to participate or contribute. It is important to provide some way to protect a patient's dignity and self-respect. Helping with logistical support or contributing something, anything, to help the next patient goes a long way to accomplishing that. Buy local when possible. Be sure that the project does not compete with the local economy. Long-term medical projects are usually preferable to one-shot or one-week missions. Make sure that participants in missions, foreign or local, are appropriately qualified. Those that we serve must not feel that they are being practiced on or receiving less than our best. Establish coalitions, collaborations, and strong relationships. Partnerships can be amazingly helpful. Consider inviting international societies to assist. Local and national government need to be included where possible. The key here is cooperation with the importing of medical items, the provision of temporary licensing of foreign volunteers, waiving fees and taxes, and so forth. When contemplating a major mission, do some advertising among your home country's significant medical institutions. They may be looking for humanitarian programs to partner with. These relationships can ultimately be as or more important than provider skills or resources at driving the success of a mission.